What's up, guys? So in this video, I'm going to be demonstrating how to do a coronavirus COVID-19 antibody test. So stay tuned. For those of you who don't know, my name is Edgman, and I enjoy making these videos about common questions patients have about medications or any healthcare related topic. So make sure to subscribe for more content. Now to the rest of the video. So how these antibody tests are formulated is kind of like a mix between a pregnancy test and how you test for your blood sugar levels at home. I'll show you guys this in a minute, but just for some background information, what it's testing for is if you have antibodies against the coronavirus. What are antibodies? Antibodies are the way that your immune system uses to fight off infections, specifically against antigens, which are foreign substances in your body, such as the coronavirus. So if you have antibodies present, it means that you've been exposed to the coronavirus previously, and thus you have antibodies against the coronavirus. So it's not a test to see if you actively have infection of COVID-19, but it does give you some insight if you have been previously exposed to the coronavirus. So when you guys open it, this is what I meant, that it looks like a pregnancy test, where you're gonna drop a couple of drops of blood in this. And so you need basically these aspects. You need the actual test kit. You need an alcohol pad to wipe your finger before you use a lancet. This is the buffer solution. This is the lancet. And so this is the dropper you actually use to get the blood off your fingers. So usually when you're testing somebody, you'd want to wear gloves. But since I'm testing myself, I don't need gloves because it's my own blood. So I'll disinfect with the alcohol pad. And the lancet, you would want to basically turn. And I'm gonna poke myself. Before I do, I'm gonna let the alcohol dry. But for this test, it's testing for 3 lines. So the first line on the bottom is the control. And then the second line is the IgG. And the third line is the IgM. Or if I go inverted like this, it'll show it for you guys. So if it's one line control, that means you have not been exposed to the coronavirus, and thus you don't have antibodies against it. If you have 2 lines or 3 lines, that means you have the coronavirus antibodies. So now I'm gonna poke myself. So what you guys want to do is trying to get as much blood as you can. So I'm squeezing my finger. Usually someone else is doing this for you guys, so it's a little easier. So I'm gonna try to get as much blood as I can. And you're gonna put the blood in the test here. Okay, so after you put a couple drops of blood in there, you'd want to open the buffer solution, and I have to open it with scissors for this one, and then put about 3 drops of buffer solution. 1, 2, and 3. Okay, so now this test is done. So in about 15 minutes, it'll show the results. So whether I have just one type of antibody or 2 types of antibody or just no antibody, which will be 1 line of the control. So this is what I meant by how it's a mix between a pregnancy test where you kind of see the results after a certain amount of time, and a mix between a blood glucose test at home where you poke yourself with a lancet and use a couple drops of blood to assess something. So it's been about 15 minutes until the results come in. As you guys see, I only have 1 line on the C, which is the control, and I don't have any lines for the IgG or IgM, meaning that I don't have any antibodies against coronavirus. But for somebody who has had coronavirus and has recovered from it, they should have these antibodies against coronavirus, and that's how this test basically works. I hope you guys enjoyed watching this video and learned something new. If you guys did, please give me a big thumbs up. And make sure to comment any questions or feedback you guys have for me. Until then, I'll see you guys next time.